So I will be administering an IV push medication. The medication I will be administering today will be metoprolol, which um, is a beta blocker. Along with this, I would explain to the patient that it is a beta blocker, which will lower blood pressure and or heart rate. Prior to grabbing my meds, I have taken a most recent set of vital signs, ensuring that the blood pressure is not below 100 systolic and the apical pulse is not less than 60. Having done my first and second checks in the Pyxis and the medication room respectively, I have drawn up my medication. The order calls for 1 ml to be administered, and using my drug guide as a resource, 1 ml should be pushed over 1 minute. So I will be pushing 0.5 mLs every 30 seconds. Having drawn up my medication, I will enter my patient's room and confirm patient identity with their name and their date of birth, as well as asking about allergies and if they've taken this and if they've had this medication before, and any adverse effects or reactions that we should look out for. Having done that, I will do my third check at the bedside with my MAR and my medication. I have labeled my syringe with the medication, the dosage that is in here, and my initials and the date as well as the time. Having done all my checks and all my pre-assessment, I will now look at the IV site and look for any redness or swelling, any signs of infiltration. And I will also pause any infusions that are running. In this case, there was no infusions running and there's just a saline lock. Doing hand hygiene and putting on my gloves in preparation for flushing and administration. I have also brought with me a normal saline flush, 10 mLs. I will go ahead and unclamp the line and I will swab with alcohol for 15 seconds. Once having swabbed for 15 seconds, I will go ahead and take my normal saline flush and attach that. And I'm keeping my cap in hand because I will be still using this. I'm going to draw back for blood. And I'm also going to push about 5 mLs. And this is just to ensure IV patency. It is flushing smoothly. I am not met with resistance and I do not see any fluid leaking. And once those 5 mLs are in, I will go ahead and cap my flush again. Taking my medication, I will remove the cap and attach. And again, my push rate is going to be 0.5 mLs every 30 seconds. So I'm going to go ahead and push that first 0.5 and waiting 30 seconds. Once those 30 seconds are up, I'm going to push the remaining 0.5. And I'm going to wait 30 seconds because there is still medication in here, which I'm going to flush into the blood vessel with my normal saline. Once those 30 seconds are up, I will go ahead and begin flushing. And I'm just going to flush the remaining 0.5 or 5 mLs that was in here from the previous. And as I'm doing that, I'm going to go ahead and get my clamp ready. And as I'm flushing, I'm just going to put that clamp in to go ahead and create that saline lock once again. After administration, I'm going to ask my patient that if they need to get up or if they need anything, to please let us know and to not try to get up unassisted, because this medication will lower the blood pressure, so they could experience dizziness, weakness, lightheadedness, or orthostatic hypotension, and we don't want any falls. Having done that, I will return to the bedside in 15 minutes to assess my patient and the effectiveness of the medication.